And how long ago did it start?
About 45 minutes ago.
About 45 minutes ago, and you said you're sweaty and nauseous?
A visit to the emergency department is changing at Essentia Health-Northern Pines in Aurora, Minnesota.
Dr. Oman, I have a patient in the emergency room. She's complaining of some chest pain, and she's showing elevation in leads 2, 3, and AVF on her EKG.
A patient with a potential heart attack. The hospital is using this mock scenario as an opportunity to demonstrate a new high-tech connection between Aurora and Essentia Health-St. Mary's Medical Center in Duluth.
Hi, Dr. Belden. I'm Dr. Oman calling from Aurora.
Telemedicine is giving Aurora doctors, nurse practitioners, and physician assistants instant access to emergency medicine specialists who are part of the Essentia Health system. Both groups of caregivers are getting trained on the new equipment.
Telemedicine in the ER is going to be beneficial for patients because we will be able to collaborate with the emergency room specialists in Duluth directly, and they will actually have eyes on the patient at the same time that we do, so they can help us through procedures, processes, get things ready on the other end if we're transferring the patient, and just ease the process.
Well, it gives them, emergency trained physicians, access to our knowledge base, so without us having to actually be there. It's always nice to be able to get access to experts of various sorts, and certainly the emergency medicine experts here are well trained and can give them, should be able to give them some good insight into some of the problems they'll meet.
Heparin is coming, nitro started, and our blood pressure is 156/78.
Caregivers communicate using high-end cameras and microphones. In Aurora, doctors and nurses can use a handheld camera to show records or give an up-close look at part of a patient's anatomy. In Duluth, medical providers can move the camera and zoom in as well.
I have the EKG here if you'd like to take a look.
Like taking a closer look at the mock patient's heart test results.
It's very clear.
Once we connect with the emergency room physicians in Duluth, they will show on the screen for the patients to see, and on the Duluth end, they will see the patient and everybody else that's here working with the patient. That's really the biggest difference, and we will be able to discuss things with the physicians on the Duluth end. The patient will as well. It'll just be an open, collaborative communication.
Dr. Michelle Oman, an Essentia Health physician based in Aurora, says telemedicine is the future of healthcare, especially when it comes to sustaining services in smaller communities around the country. She is eager to point out the benefits to local residents.
Physician recruitment in smaller communities is very difficult, and the rural areas nationwide can benefit from telemedicine in many ways, and this emergency room project is one of them. It gives us the ability to have additional services available to us.
This is Dr.
Nelson.
Dr. Nelson.
And I'm Dawn, I'm the nurse.
Caregivers already collaborate over the phone. This new development gives the emergency medicine physicians in Duluth a first-hand look at Aurora patients.
So we got nitro, heparin, aspirin, and TPA.
Without ever having to leave the St. Mary's emergency department.
I didn't expect any of this when I came out of med school. This is awesome. It's a great experience. I think it's great for the patients, it's great for us as care providers.
We're always searching for new and innovative things that can enhance the patient's experience, and hopefully this will be one that really enhances their experience.
Essentia Health leaders say the new telemedicine initiative is all part of a larger goal, providing high-quality, sustainable health care close to home for patients in larger and smaller communities across all of the regions Essentia serves.